Good afternoon. My name is Jonette Prince. I'm the nursing student. As a nurse practitioner, I work with Dr. Mensis today. And your name is Rashid, correct?
Yes, ma'am.
And you're here for a physical?
Yes, ma'am.
I have a question for you. Could you tell me your date of birth and how old you are?
06/21/1987.
Okay.
I'm 37 years old.
And where are you at today?
I'm sorry.
Where are you at today?
I'm here at the clinic to get a physical done.
Okay. So I see you're getting a physical day. Are there any other ailments that you would like to discuss? You know, sometimes with the annual visit, patients would want to discuss other issues besides their physicals. Do you have any concerns with your health that I need to be made aware of?
Not at all, ma'am.
Okay, very good. So, in terms of your past medical history, could you tell me, do you have any significant illnesses that you had as a child or as an adult?
No, not at all, ma'am.
Any hospitalizations that you had?
No.
Okay. Have you had immunizations to include like your COVID vaccine, your flu vaccine?
Yes, I do get a COVID vaccine, but a flu vaccine, I don't get that.
Did you have a pneumococcal?
No.
You didn't have.
The pneumococcal vaccine, yes, I did.
You did
I
have
got
no.
that, yes,
Okay,
ma'am.
good.
That's right.
So you're up to date with all of your vaccines?
Yes, ma'am.
Okay, very, very good. In terms of any medications, are you currently taking any medications?
No, ma'am.
Do you take any over-the-counter medications for like a multivitamin or anything like that? Any herbal recipes?
Yeah, I do take a vitamin B12.
Okay, you do. And why do you take the vitamin B12?
Just, everybody says to take vitamins, so that's why I decided to take some.
Okay, very good. Do you have any allergies that you're aware of?
No, ma'am.
No allergies. No allergies to food, animals, environment.
No allergies at all.
None of that. Okay. Okay, so as far as your family history, how is the health of your mom or your father?
Pretty good.
Do they have any ailments or diagnoses?
No, not at all.
Do you have any brothers or sisters?
Yes, I have two sisters.
You
No
have
problem.
two sisters. And how is their health?
They're pretty good.
No issues
No
whatsoever.
issues at all.
Okay. Could you tell me a little bit about yourself in terms of work? What type of work do you do?
So I'm a caseworker.
Casework. Okay.
Caseworker and a long-term care facility.
Okay. And what is the highest level of education you completed?
A master's degree.
Okay, very good. In terms of your family and your social relationships, are you alone? Do you live with someone?
Yes. My mom actually stays with me.
You live with your mother. Do you live with anyone other person?
No.
Do you have any issues at home?
No, not at all.
Okay, and you have very good support for your family there?
Yes, ma'am.
In terms of your sexual history, do you have a sexual partner?
Yes, I do, but right now I'm just upstairs.
Or you do have a sexual partner? Are you sexually active?
No.
Or did you say you were abstinent?
Yes.
Okay, very good. Now, if you were to engage in sexual intercourse, what was the preferred method of contraception?
You have to stay, safe. So I just use protectors.
Protectors like condoms?
Yes, ma'am.
Or use condoms? Okay, just trying to clarify. In terms of your social history and drugs, have you ever smoked, drank, or did any illicit drugs?
No. I only drink occasionally.
And when you say drink, alcohol?
Oh, yes, wine.
Yeah, wine. And when you say occasionally, how many times a week would you say?
2 or 3 times in a month.
2 or 3 times a month, so very rarely do you
Yes.
drink. Okay, very good. And I was going to say, so your abstinence, and when you were absent, you were in a monogamous relationship?
Yes, ma'am.
Okay, let's talk about your exercise. Do you exercise?
If that includes walking, my role includes me, walking, every single day. So I don't go to the gym.
Do you do any other exercises besides with your work, walking?
Well, so in addition to me working as a caseworker, I'm also in the military. So every month when we go for our drill, we do just a little bit of exercise that we have to do.
Okay, but no other additional exercise besides
No.
that, no routine? How would you describe your diet? Is it healthy or?
No, it's healthy.
Okay,
I
was
try to
it,
stay healthy.
okay, lower fats, low salt,
Yes, ma'am. A lot of vegetables.
vegetables, very good. And do you have any stress factors that, in terms of your psychosocial well-being? No, nothing like that. Okay, very good. So I'm going to ask you some general questions. This is called the review of systems, and you can just say yes or no if this is present for you. In terms of your skin, have you noticed any rashes, any dry patches, any lesions, anything on your skin?
No.
Very good. Your eyes, they look relatively normal, but have you had any areas or issues with it being watery, dry, itchy, runny? No. Okay, very good. In terms of your mouth, have you had any issues with your mouth, like pain, an abscess, or tasting, swallowing, anything of that sort?
No.
Okay. In terms of your respiratory status, have you had any shortness of breath, difficulty breathing, or any pain in your chest, in your lungs?
Not at all.
Okay. Gastrointestinal, do you suffer from any nausea, vomiting, or stomach cramps?
No.
Okay. Musculoskeletal, do you have any pain in your joints, stiffness, pain? None whatsoever. Arthritis, none of that. And difficulty with your mobility?
No.
Okay, very good. Your respiratory, your psychiatric history, have you had in the past, or do you currently have issues about the depression, anxiety, or maybe any phobias?
No.
Okay, and as far as your neck, have you had any pain in your neck, difficulty swallowing, turning to the left or to the right?
No.
Okay, very good. Well, that completes your interview for your examination. Now I'm going to do a physical assessment of you. And what I would ask for you to now do is to sit on the bed, and I'm going to wash my hands, okay? Do you have any questions for me?
No.
I see you're already prepared, so that's a great thing. So if you'd like to just sit on the bed, I would appreciate it greatly.
Do I take off my shoes?
Yes, please, if you can take off your shoes, I would appreciate it. Thank you. I'm going to move this out of the way. Let me move this. Excuse me. Let me make sure that you're comfortable. Sorry. Let me move this over here. Okay, so you're on the bed. Excuse me. Alright, so the very first thing I want to do is look at your head. What I'm seeing currently is that you have a normal cephalic head, meaning that your head is normal in its presentation. I don't see any asymmetry or any visible masses, lumps, or lesions on your scalp because your hair is very low. I'm looking at his face. His face is normal in terms of its presentation. I don't see a shift in his eye symmetry. It's very level. It's same as with his nose and his mouth, and his ears are also even. They're not low set. They look relatively normal. I see nothing. His skin is moist. He's an African American male. It doesn't look dry. I don't see any visible bruising or anything on his face or moles that would be substantial. And his lips, they look a little dry, but they look normal. They look moist because I'm looking at the interior of your mouth. Okay, so what I'm going to do is, could you do me this favor? Lift your eyebrows up, put them down. Okay, and I'm going to inspect I already used hand sanitizer. I'm going to inspect your scalp. What I'm going to do is I'm just going to feel, okay? Is that all right for you? Feel the top portion of your hair. I'm going to try not to. I'm looking at the hair distribution. I'm looking at the front. I'm going to go around to the back. Excuse me. Just to make sure that I look. I'm feeling, because you hold your head back, I'm feeling his hair, and I'm looking at the distribution. He has very good density to his scalp. I see no masses, lumps, or lesions. I see no erythema, no pain when I touch.
No, ma'am.
No? Okay, good. I am going to now come around to the front. Now, what I'm going to do is ask you I'm going to look at your eye exam first. I'm going to start with that. Well, the very first thing I want to do is look for my pen light. My apologies. And I just had it. Okay, it's right over here. Well, thank you for helping me out.
No.
And I'm going to sanitize my hands because I know I've touched your scalp. A little bit of oil there. So here we are. I'm going to dim the room slightly, okay?
Yes.
So what I'm going to currently do is look at your eyes, and I want you to just look straight ahead. Just look straight ahead at me. I'm going to see if I'm able to see if your pupils respond to light accommodation. And he has dark eyes. And it does. And I want you to just pay attention to this. I'm looking for, looking for consensual. Okay, I want you to follow the pen with your eyes, not me. Okay, follow the pen. Okay, convergence. Very good. Now the next thing I'm going to do is I'm going to actually look inside of your eyes to the optic discs, and I just need to open this up. Be right with you. Hold on.
Yes, sir.
I'll be looking at the cranial nerves, so I just assess cranial nerves. I'll be looking at 3, 4, and 6 soon, but I'm looking for light accommodation, which is actually the optic nerve. And there is one other thing that I can look at while I'm here. So before I do that, just do me this favor. I'm going to sit this here. You don't wear glasses,
No,
do you?
ma'am.
Okay, I want you to read the very last line that you can visibly see.
LTFBH.
Very good. Your vision is very good. Okay, what I'm now going to do is I'm going to look inside of your eye and look into your fundus. We can put this light on. Okay?
Yes, sir.
And what I want you to do is look straight ahead. But before doing that, I want to see if I'm able to see this. I'm looking to see if I could elicit the pupillary, the reflex. Okay. Now I'm going to look in with your fundus. This might be a little bright for you, but just tell me if this is too much, okay? Just look straight ahead. Look over. So I'm looking at the fundus, and I see in the fundus that I see no opacities, I see good vascularization, I see no signs of hemorrhaging or macular degeneration. The fundus looks relatively normal, okay? And that's for the right eye. And I need to go on the left eye using the left side. So just look straight ahead. Okay, and I'm looking, it's gonna be a little bright, so I'm gonna go in. I'm looking here, and I see, okay, I see the fundus, yeah. There's no opacities here. I don't see any, the vessels look normal in presentation. I see no opacities, and I don't see any signs of macular degeneration, okay? I'm gonna cut this off because I'm done with that portion of the assessment. I'm gonna cut the light on if that's okay.
Awesome.
I'm going to test your ocular movement, which is actually 3, 4, and 6. And those are the ocular motor, the trigeminal, and the 6 is abducens, okay? So I want you to just follow this pen without moving your head, okay? Okay, excellent. So you can tell that he is able to, there's no nystagmus or strabismus that will let me believe that there's an issue with those cranial nerves, which is very, very good. I'll move on now to the cranial nerve 5. And could you do me a favor, because the part of the cranial nerve for clenching teeth is the trigeminal. Could you do like just bite down very hard? Okay, no pain or anything? Okay, close your eyes. I want you to tell me, do you feel a prick or a sense of, what do you feel?
So I felt like right here, but this was like a little pitch.
A pinch. Okay, good. Close your eyes. Again. Just tell me which side of the face you feel it. What do you feel now? A soft touch. Okay, so that's very good, because that means to me that your sensation is intact, which is cranial nerve 5. Now, I want you to smile for me and puff out your cheeks. Look up and look down. Okay, that is the cranial nerve number 7, which is the facial nerve, which says to me that that's also intact. And now I'll be looking at your hearing. I'm going to go around to the back. This is the vestibular. I'm going to whisper word for one. Tell me when you hear something. What side?
Yes, sir.
Okay.
Yes, sir.
Okay. What did I say?
Blow.
What did I say?
Green.
Okay, perfect. So Very good. Cranial nerve is intact. I'm going to use my glasses because I have. The next thing I want to look at is your gag reflex. And I'm going to look at the same time while I'm doing that, I'll be inspecting the inside of your mouth, okay? I'll use some gloves because I will have to palpate inside of your mouth, if you don't mind.
That's fine.
This will be for cranial nerve 9 and 10, which are the glossopharyngeal and the vagus, okay?
Yeah.
I'll use this one. Okay, perfect. Oh, could you say ah for me?
Ah.
Look, it's ah.
Ah.
Okay, so the palate, upper palate, it rises. His tongue, stick out your tongue to the left or to the right. Okay, and that's the hypoglossal, which is the cranial nerve 12 is intact. I also see that 9 and 10 is uvula is midline. I'm just now going to, if you don't mind, I see no evidence of dental caries, no masses, lumps, or lesions inside of the mouth. I'm going to feel. No masses. Could you lift up your frenulum? Your tongue, you did good, okay, and it's midline. And you stick your tongue out and in, okay. So all of the cranial nerves have been assessed. Very good. I'm just going to take this off and throw this away. And, okay, what I'm going to do then now is look inside of your nares. So you can just hold your head slightly back. This inferior turbinates are seen. I see no masses. I see hair that's normal and present. I see that his septum is not deviated to the right or to the left. It appears patent with no exudate or any exudate signs or symptoms of erythema, masses or lumps or lesions noted. Same is true with his mouth. Very good. I'm going to go behind and assess your lymph nodes. I'm going to start here. This is the postauricular and preauricular. I feel no masses, lumps. I feel no presence of lymph nodes to say that there is nothing. So now here I'm looking at the submandibular. This is the submental. I feel nothing. Here is the sternocleidomastoid anterior. And I'm going to look at the supraclavicular. And I have no palpable lymph nodes, okay? There are other lymph nodes that would be on your trapezes and your arms and other areas, but I feel nothing in this area, okay? Now I'm going to go ahead and palpate your thyroid, okay? Excuse me. Get behind you. Just hold your neck back to me.
No.
So my hands are on either side of the trachea. Does that feel, is that painful with what?
No.
Okay, I'm going to shift it to the left. Okay, I see I feel the trachea. I feel here the thyroid, and the substernal notch, suprasternal notch. And I'd like for you to do me this favor. I want you to swallow. That didn't hurt, did it?
No.
No, okay, good. So his thyroid is intact, his trachea is midline, there's no palpable masses, lumps or lesions, or lumps that are noted upon palpation. So now we're going to look at the thorax. Oh, well, let me just do this before I do that. I'll go ahead and look at the cardiac. Okay, I'm going to assess this. So before I assess, I'm going to just feel. I don't want to occlude both sides, so you can make the patient uncomfortable. You may have a little syncopal episode, but the carotid is palpable. I'm going to listen with my diaphragm as well as with my bell. It's audible, obviously. I don't hear any significant thrills or bruits that would suggest that they're. I'm going to also listen with the bell. On this side. Okay, and typically, if you're looking for jugular vein distension, you would have him lay at about a 45-degree angle with his head off of the bed. You'd have him turn his head to the left, but he's a healthy young man. I see no JVD signs or symptoms. Okay, I'm going to ask you now to. I'm going to get ready to. Could you remove your gown, if that's okay with you?
Yes, ma'am.
Would you like to? Would you turn away? Just give the patient some privacy.
Oh.
Okay, so you're standing up. Okay, perfect. So you said you didn't come around. So you have to actually remove your shirt too as well. I have to look at your shirt. So we can just turn back around again.
That's fine.
We typically would want to leave the
That is
leave the
fine.
room.
That is fine.
Are you sure?
Yes, ma'am.
Okay. So you can turn around. He said it's fine. So I'm looking at the contour of his chest. You're trying to see, is it concave, convex? There is a slight. Could you sit up straight for me? Okay. Perfect. Okay. His chest is neither convex or concave. I do see that there's a slight slouch to the front. I don't know if it's just positional for him, but as far as his position, okay. But I see no asymmetry with his chest. It suggests that there's issues in terms of his respiratory status. His respirations look even and unlabored. I am going to also now look. I'm looking at the general appearance of his arms, and I see that there is some. Oh, I'm sorry. Bless you. Are you okay? I see that there's some. I don't know if this is like macules or are these old acne, or just.
No, that's all right. That's growing up.
Just growing. Okay,
Yeah,
growing.
growing up when I was like.
You're picking.
No, I got like when I was stubborn.
Oh,
So
really?
yeah, so that was just growing up.
Oh no, I didn't know that.
That's-
Okay, so are you okay from that? Okay, good. So those are scars that you've had since being a child. Okay, and I see that he does have a mole next to his right interior area, slightly above medial. I'm gonna look on your back. Come around here. I see there is nothing. Well, you could say there is nothing that's different from the front. They are pretty consistent. He has some demarcation. They look like macules on an African American male. That's something different, but they're hyperpigmentation on his back. There's just slight. I'm just gonna now, as I inspect it, hold on. Just want to make sure. I want to begin to palpate. So since I'm already in the back, I'll palpate. Okay.
Okay.
Nothing tender. No masses. I feel none. Okay, on this side over here. Now what I'm going to do is percuss, okay? I'm going to start here at the intercostal space. And over here, excuse me. Okay. Go around to the back. Typically when you're over the organ, you will hear dullness is what you heard. And when I went to the right side, this is posterior. Okay. No abnormal percussions that were noted. The next thing we're going to do now is I'm going to auscultate his lungs. Okay. Start here. Take a deep breath in. Breathe normally after that. Okay. Excuse me. I'm going to ask you to say the word 99.
99, 99, 99, 99.
So it's egophagy throughout his lungs. There is no changes in his voice pattern and vibration, which suggests that there's a consolidation. Obviously in the front, you do have organs. To his right would be his liver, and to his left, the spleen and the liver. There was some tympanic areas noted when I did percussion to the front, but that's consistent with the upper gastric region of the stomach. All right, so I'm done with the respiratory assessment for you. I'm gonna now do the cardiac assessment. So I'm gonna go ahead and start with that. Listen with the valve first, the diaphragm first. I'm placing the diaphragm on the aortic, second intercostal space, mid-sternum to the right. Left of the right of the sternum, the right intercostal space, the left intercostal space. This is the pulmonic valve. 4 centimeters down would be Erb's point. This is where you would listen for any abnormal murmurs. Here, it's like the 5th intercostal space, it's not mid-clavicular, but it's to the sternum. This is the tricuspid. Point of maximal impulse is the 1, 2, 3, 4, 5, 6 intercostal space, mid-clavicular. It's the point of maximal impulse, and it's bounding. Okay. I also want to have you lay down on the side, on your left side, and put them on the left side. On the left side. Sorry. Okay. I can just cover you. Yeah, there you go. Is that better for you? In the recumbent position, I want to see if I'm able to hear any abnormal heart sounds on this side. Check. I'm going to do that with the bell. It's normal, nothing abnormal. And I'm going to ask that you sit up and turn around and pull your legs over to the side. I'm on this side over here. And I'm going to also ask that you just lean a little forward because I want to see if I'm able to hear any mitral valve stenosis or any aortic stenosis in the front of his chest. And I hear none. Okay, very good. The next area of business would be that of I did assess your carotid. I made sure that was auscultated and assessed for bruise. Okay, now I'm going to ask that you lay down because...
On my back?
On your back again, I apologize. Although I palpated your chest, I did not assess for the point of maximal impulse. Sometimes you're able to see it and you're able to feel it, and I did actually feel it. I just didn't mention it. And this is in this area right here, and you absolutely can feel it. It's bounding, and that's consistent. That's normal. That's not an abnormal finding. The next thing I'm going to do is actually listen to look at your abdomen. I'm going to physically inspect it first. So let me go over here. I'm looking for the contour of his abdomen. It's normal. It's not concave or convex or scaphoid. It has good symmetry. Doesn't look protunded, where there's just like a distended of any capacity. And all right. So I'm going to now auscultate. I want to listen to your bowel sounds, if that's okay with you.
Yes.
I'm going to take the bell of the stethoscope. The diaphragm of the stethoscope. I'm going to begin. Okay.
Yes.
Now, when you're listening, you're seeing are there any, there's no hypo or hyper active sounds. They are within normal limits. I'm going to also listen here for the aortic and renal artery, because here you could have a bruit or thrill. I do hear it, but I don't. There is nothing I note to be like turbulent to suggest that there's a bruit. Okay, and I'm going to also palpate. I'm going to see if I can see the pulsatile movement of the aortic and renal artery. And if you look here, you can see it. It's right there. You see that? On the side. I know it's kind of difficult. All right, you did very good with that one. I'm going to now percuss your abdomen. Okay, now I'm going to start slightly above in this area. Now, if you notice, here it's dull. The reason being is because this is the liver, but over here it's more tympanic, and that is where the epigastric region of the stomach is. There's a little tympanic here. And this is where the cecum is at, okay? So no pain or tenderness?
No.
Are you sure? Nothing unusual? Yes, okay. So I'm going to now palpate. I'm going to do a light palpation, okay? I'm going to just do like this and just breathe normally. It shouldn't be. Okay. That doesn't hurt, does it? No. This is light. Now I'm going to do deep. Now this is going to be a little uncomfortable. What I want you to do is I want you to take a deep breath in. Take a deep breath in. Put my hand under here. You can let it go. Okay. Take another deep breath in. You have strong muscles. Very good. Okay. So I was not able to feel the ridge of the liver, and when I palpated this here, it's about 7 or 8 centimeters, maybe 9. And it starts to get a little less right here, but I was not able to feel the ridge or the edge of the liver. Now here's the spleen area. I want you to take a deep breath in. No, just, okay, so turn to the side. No, this side over here. And just, okay. Is that uncomfortable for you? Now, I cannot actually feel, thank you, you can go back on your stomach, on your back. I cannot feel the ridge of the spleen, which suggests to me that there is, that's a good thing because you don't have splenomegaly.
Oh.
And I'm going to, you said, I'm sorry, what did you say?
No, that's okay.
Okay, very good. I'm going to go on to the next system for you, which is the peripheral vascular. So what I need you to do, you can sit up now, and you can turn around to the side. So now I'm looking at, we discussed his, the presentation of his skin. I'm looking also at his musculature. There is no pain or no palpated, no?
Yes.
Okay, I'm going to feel the brachial pulses. They're present. Radial pulses. Bounding, very good. I want to, his hands, they look relatively within normal limits. His nail beds look not unusual, they look normal for his race, and because they're slightly dark, I'm going to pinch, and you see the capillary refill in that hand. Perfect. I want you to turn your fingers over. I see no like macules or any discolorations in his extremity. Okay, now I'm going to ask that you lay back down again because I have to finish
On my
doing
back?
On your back again. Apologies.
No, you can, man.
Now I'm going to get some clothes on. Hold on. I'm going to feel in his groin area because his groin area is important to see is there any herniations and I'm going to also listen with the bell of the stethoscope. So you can look over here. Just going to place my finger right in this area here. And that is the groin, the inguinal area. And I don't feel anything that's unusual, just in this area here. It doesn't hurt?
No.
Okay, I'm going to use my stethoscope. Thank you. You just listen. Okay. Upper ear present. Okay. Okay, perfect. I'll need you now to sit up, and I want you to dangle your legs over the bed. You can pull this up if you want to. Okay, good. Just if you can get all the way to the edge of the bed. So what I'm looking for, you can let your legs dangle. What I'm looking for is the symmetry in his legs. I'm going to feel your muscles. They're symmetric. Your feet are a little cold. The hair distribution is appropriate. There is no pain when I palpate the muscles. And I want to also in your feet, I'm also assessing the capillary refill, and it's present there. I'm going to ask, because I'm going to continue to the assessment here, the popliteal. Just let your legs just let them hang freely. See if I can feel them. And you're a young man, and I do feel like they're strong. Like literally, especially on this side, the left side. Okay, I'm going to also look at the dorsal pedalis at the top. They're present, and the area behind the ankle. Okay, again, there is no, his skin presentation is warm and dry. I see no mottling, no erythema, no signs of vascular compromise, good hair distribution, the circulation is good, and his feet are fine. I'm going to ask that you do a couple things for me.
Yes, ma'am.
I'm going to assess, this is the cranial nerve number 11. It's the accessory muscles. And I'm going to ask that you put some hand sanitizer on. Sorry. All right. I want you to turn your head against resistance to the opposite side.
Oh.
So you're going to turn your head that way. Okay, very good. Don't, not too strong because I'm weak. The other side. Okay. I want you to shrug your shoulders up. And okay, very good. So I want you to put your hands out. We're assessing range of motion. Put your arms all the way up. Pull them out straight to me, to the sides, and down. I want you to pull your hands into yourself. Like what I'm going to do now, I'm going to test your biceps. So you're going to take your hands and just pull your hands into your chest, but I'm going to hold up against resistance. So pull towards yourself. Okay, good. Good bicep strength, +5. Now you're going to push them out. No, take your hands here and press out to me. Good triceps, yeah, strength. And I want you to take your hands, let me see, for your wrist. Okay, that's supination. Okay, very good. Same thing as with your hip. I want you to lift your hip up, right leg, and then the left. And then I want you to push your legs out while I'm holding them. Okay, strong. Then pull them in, adduction and adduction. I want you to push your legs out toward me. Okay, flexion. This is flexion. Okay. So he has good strength, +5 bilaterally. And I want you to dorsiflex, push your feet down. This is plantar flexion, push your feet up, dorsiflexion, +5. Okay, the next thing I'm going to be checking right now would be your reflexes, okay? I'm going to first assess here his brachial. You see that? Good reflex. Not hyper, because if it was, very good. Now I'm going to take your arm here and assess your elbow. Okay, a little bit, jerking it just a little bit. Okay, if it was, okay, just a little bit. Okay, if it was like really like hyper, that would show that there is an issue with an upper motor neuron, which you don't have. I'm going to just test down here. The patella. Okay. Okay. Back on the Achilles. Good. All right. And the next thing we're going to check is what they call the Babinski's reflex. I'm going to take this here and we're just going to hold your feet out just a little bit. Okay, there you go. This is curling of the toes just a little bit. Okay, that's a normal finding. Does it feel a little funny? My apologies. If you want to put your shoes on, this will be close to the last part of your examination. And for his reflexes, they were all 2. That means they were within normal limits. I'm going to ask the patient to stand up, and he can put on his gown. If at this point, I just want to look at the curvature of your spine and observe your gait. And yeah, that would be almost it. You got it? Okay, very good. I don't mean to rush you. You can put your gown. Now this is the only thing. You can put the gown around your bottom. I just need to look at your back, actually.
Okay.
Yeah. Perfect. Okay, good. So you can just observe your gait. You have them walk. Just walk. You're very tall. Just walk a little bit to the wall. Okay, and come back toward me. No, you can turn around. You can turn around. Okay, come try. Okay, perfect. Now I want you to do me this favor. Turn back around. I want you to bend over slightly, and I'll cover you up. Just bend over slightly, all the way. So I'm looking at the normal curvature of his spine. There is no signs or symptoms of like scoliosis or curvature. I see no lordosis, no kyphosis. Is there any pain when I touch?
No, ma'am.
Okay, you could sit up. And that actually would conclude my examination. Thank you so much.
No.
And it was very nice to have met you.